to the third video in our A to Z series. Today's letter is C, which stands for clarity in health communication. Now, why is it important to communicate clearly? First of all, this ensures an accurate information exchange, meaning that information about medical conditions, treatments, and procedures is accurately conveyed between medical communicators and patients, which ultimately can reduce the likelihood of misinterpretation or confusion about important details that could affect patient safety or outcomes. This also leads to more informed decision-making in patients once they receive clear and understandable information, because they can then make more informed decisions about their healthcare. This allows them to weigh benefits, risks, and alternatives of treatments so that they can participate actively in the decision-making process and make sure they make decisions that align with their values and preferences. Thirdly, misunderstandings can compromise patient safety. So clear communication is important in that it helps ensure that patients understand the instructions for post-operative care, medication dosages, potential side effects to watch out for, and any steps to take in case of an emergency. This helps reduce the risk of errors, adverse events, and unnecessary hospitalizations. This leads to more efficient healthcare delivery. Clear communication streamlines healthcare delivery by minimizing the need for repeated explanations or corrections due to misunderstandings. This then allows those in charge of transmitting medical information to allocate their time effectively and focus on the patient. Now, what are some tools and techniques that medical communicators can use to enhance clarity in their communications? One of these techniques might be using plain language, so avoiding medical jargon or super technical language, which patients wouldn't easily understand. If you stick to plain language, this helps to explain complex medical terms in simpler terms and provide analogies or examples to help clarify concepts for the audience. It's also really important to be an active listener and pay attention to people's concerns and questions when a conversation is taking place, taking care not to interrupt or distract from the topic. You can also use visual aids, which might be diagrams, charts, or other models, to help illustrate medical conditions, treatment procedures, or human anatomy and physiology. And providing these tools in physical as well as digital formats may be helpful for people to store and take home for future reference. Lastly, it's good in some contexts to ask open-ended questions, which will then invite and encourage the audience or the patient to engage in open dialogue. And this facilitates a comfortable space for people to share feedback and ideas. Now, what are some benefits of clear communication for both the medical communicator and the respective audience? On the patient side, as we've discussed, you might see improved compliance and adherence. And when patients are more likely to adhere to their treatment plans, they're more likely to experience better results from those treatment plans and an overall improved quality of life. Also, patient safety is enhanced in this. As we've mentioned, it reduces the risk of misunderstandings that could lead to medication errors or complications from procedures or other adverse events, and thereby promotes patient safety. You might also see increased satisfaction because when patients feel well informed and understand their healthcare journey, they're more satisfied with their overall care experience and place more trust in those who relay this important health information to them. Now, on the other side of the equation, clear communication allows those relaying this important health information to convey details accurately and concisely, getting key points across to the audience in an efficient and effective manner. You might see outcomes such as improved patient engagement because if patients understand their conditions and treatments, they're more likely to actively participate in healthcare decisions and follow through with therapies that are recommended to them. You might see reduced errors because clear communication reduces the risk of misunderstandings, which can also reduce liability for improperly transmitted medical information. This also leads to efficiency and time management because when you cut out the need for repeated explanations or clarifications, you can use your time more effectively to focus on patient care itself rather than on resolving misunderstandings. Overall, I hope that these ideas are helpful to consider in this area of clarity in health communication. Thank you everyone for joining us today, and we're so excited to have you back next time for video D, which stands for decision making. And in that video, we'll take a look at patient empowerment.